here today. This is an important meeting for our community. And my name is Issam Nejim. I'm the president of the Porter Ranch Neighborhood Council. The Neighborhood Council organized this town hall meeting to get important information regarding the health effects of the gas exposure. Nothing the Neighborhood Council is saying today or doing anything today. We're simply offering the floor for Dr. Nordella to make his presentation and talk to us. And then we will open the floor for anyone to get up. If you want to ask a question, you want to make a comment, that's your choice. This is not an official meeting of the Neighborhood Council. In other words, we're not taking records. There are some filming going on, but other than that, this is not an official meeting where we're keeping record on it in terms of noting. And then at the end, we have some representatives of public officials here that I'm going to do my best to remember to ask them to stand up and either make a comment, or if they'd like to say something or ask a question, that's also their choice. So I'm not going to ask for speaker cards. I'm sure after the presentation you'll have new questions, so there's no way for you to know up front that you can ask something, so we will leave it open. I will just ask that we keep the time. We're going to try to limit the question and comment to 2 minutes per person unless we have more time, and obviously we'll open it more. So I'm going to try to manage it on the fly, so please bear with me, and hopefully we will have an informative meeting. Dr. Nordella, you've all seen the announcement that I sent out. He's the medical director of the Porter Ranch Quality Care, and he has some information that he would like to share with us to the extent that he can. I have no commentary on the information because I don't know it. So, Dr. Nordella, the floor is yours. What we're going to do is going to be a PowerPoint presentation. And I would like him to go through his presentation and not stop him in the middle. If you have a question, keep a thought on it. And when he's done, we'll turn the lights back on, and you can ask him whatever question you'd like to ask. Sounds good? All right.
Speak really loud.
Get the microphone. There you go. You got to get real close. You got to get close.
How's that? Can you hear me?
No. Switch the mic. No.
How about now?
Yes.
Sure you want to hear me?
Yes.
Yeah. So, I want to introduce myself for those who don't know me. My name is Dr. Jeffrey Nordella. I'm a medical director at Porter Ranch Quality Care. And I thank you for having me. A little bit about my background. We've been open since May of 2009. We're about 3 miles dead south of the gas leak. I attended the University of California, San Diego, received a bachelor's degree in human bio, went to UCLA Med School, received my medical degree, trained in both family and emergency medicine. I'm not going to tell you how long I've practiced. I have to go through disclosures really quick. I've not been contacted by any representative from Symptom Energy or the gas company. I'm not part of any activist group. I have no financial incentives in doing this. I have no relationships with any legal firms, but for full transparency, I was recently approached by a law firm and offered to retain me, and I politely refused. I wish to maintain total neutrality. I initiated a health screen, and why? Simply because no one else was. The study was not to prove or disprove causation, but only at best to identify associations, and I'll explain that in a minute. I started reviewing the chemicals/toxins the community had been exposed to, at least the ones that were announced publicly, because that is in still question at this time. I discovered a number of toxins that had both acute and chronic effects, some which might not become evident for up to 5 years. Therefore, I recommended and implemented a baseline health screen. It's important. I personally met the exposed patients face-to-face and completed a present-day history of past medical history and performed a physical exam. Also, baseline testing was ordered. Some of this testing was a CBC, or a complete blood count with differential. Measures basically your bone marrow function. Obtained a metabolic chemistry panel. This looks at a patient's blood sugar, electrolytes, thyroid function, renal function, and liver function. 2 view chest x-rays were obtained, as well as a pulmonary function testing. Lay a little foundation for the exposure of what I know, and I'm sure we all have our own knowledge base. We all know that this gas blowout was the worst this nation has really seen. We also know that the community was exposed to components of natural gas as well as contaminants and toxins. What we don't know from a reliable, unbiased source is exactly what we have been exposed to. How much and how long we've been exposed to it. Take the fact of what? Or question, excuse me. I recently had a face-to-face meeting with the Los Angeles County Department of Public Health. It was disclosed by themselves that they are really unaware of the entirety of the composition of the gas. That is important to me. How much? In my opinion, this has not been answered as well. The who, where, when, and by what technology, I'm personally unaware of. You'll hear stories about somebody had a meter at somebody's fence and here and that, and what meter they were reading, and is it benzene, is it methane, what are they reading? I have no idea. No one has disclosed any of that to me. I'm unaware of anyone discussing the scientific principle of body weight dosing. And basically what that means is give you an example, you wouldn't give your child the adult same strength Tylenol you take, because we know that Tylenol destroys the liver. How long? This topic is very complex. Was there a chronic exposure prior to the blowout? I get this question all the time, and it's a whole other chapter in the study. So again, if that's the case, what was released, how long, and how much? Again, we get back to those points. Then came the peak exposure from the acute blowout, followed by the re-release of gases into the community through the erosion of the soil. And we've now seen a secondary spike in symptomatology from patients. So let's go through the chemicals that we know. First is methane. It's part of natural gas. Second, mercaptan, hydrogen sulfide, benzene, which is classified as a VOC, which I'm sure you all know that word by now. There's question of radon and also the metals. What metals? Manganese, strontium, lead, aluminum, and questionably others. Let's go through some side effects of methane. And this is in the literature. And this literature research is incredibly broad from numerous sources. Methane side effects. Absolutely dose dependent, number one. But you can get headache, dizziness, fatigue, shortness of breath with cough, nausea, and vomiting. Benzene. Side effects: cough, dizziness, headache, nausea, vomiting, palpitations. Very important, last point, bone marrow suppression. Well documented in the literature for anywhere from a basic anemia, leukemia, and aplastic anemia, which we'll talk about in a minute. Mercaptan, the addition for the odor. It's a sulfur molecule. They add it to the hydrocarbons. It gives the stink. Headache, dizziness, nausea, vomiting, diarrhea, pulmonary irritation, cough, wheezing, increased heart rate / palpitations, eye and mucous membrane irritation, and dermatitis, inflammation of your skin. Hydrogen sulfide, cough, shortness of breath, eye irritation, fatigue, nausea, vomiting, pulmonary edema, headache. This is a potent vasodilator. We'll address again in a minute. Radon. Radon is a radioactive atom. Its decay is 3.8 days. Dissipates, has a half-life. Gives off radiation from the nucleus of the atom, which potentially causes DNA mutation to the human cell. Leads to cancer. Has been associated with CLL, or chronic lymphocytic leukemia. Exposure is associated, very important, with lung cancer, mainly in smokers, and also former smokers, of which the literature will classify as I've quit 10 years ago, I've quit 20 years ago. Lead. Everybody knows about lead from Michigan. Abdominal pain, constipation, headache, irritability, tingling in hands and feet associated with anemia and central nervous system disorders. Aluminum. Again, contact dermatitis. Very important, this last point. This is associated with estrogen-related illnesses. Breast cancers that have receptors that are sensitive and accelerate the breast cancer from estrogen and are on a medication like tamoxifen will then be inhibited, the tamoxifen, to do the job accelerating the cancer. Manganese. Parkinson-like syndrome. I'm not even going to try and pronounce that. It's also associated with central nervous system disease. Strontium, potential bone growth abnormalities. Now, a cumulative effect. What does that mean? Everything I've read in the media, every quote, has never really responded to this, and I can't really even find it in the literature. What that means is there's no study or documentation that I can find in the literature that addresses the human response after being exposed to all these chemicals at one time. You look in the literature and you'll find every toxin, every chemical has its own group of side effects, as I just listed, on its own merit, but nothing has them combined. So what I did is I went back and I cross-referenced the symptoms, and I looked at the toxins of the potential side effects of the toxin with a particular symptom, starting with headache. We have 4 out of 4 of the particular chemicals can cause headache as well as one metal. Cough, shortness of breath, 4 out of 4 with one metal. Dizziness, 3 out of 4. Fatigue, 2 out of 4 with one metal. Rash, 2 out of 4 with one metal. Nausea and vomiting, 4 out of 4 with 2 metals. So getting into the health screen study. It was initiated in January 2016, approximately 10 weeks after the blowout. New study group is forming as of this January in 2017. 53 patients were involved. 31 females and 22 males. Age span 11 through 80. Concentration of patients between the 40s and 60s was the heaviest population of patients. 52 of the 53 patients had symptoms. There was one patient that came in that was asymptomatic to anything, and he just wanted baseline labs drawn for the future. 52 of 53 patients had 2 or more symptoms. 52 of 53 patients had symptoms within 2 weeks of the blowout. Mileage from Aliso Canyon Complex ranged between 1 and 5 miles. Residents were located from southwest to south to southeast, almost in an equal distribution, almost like a pie. or I should say a piece of pie, excuse me. 54% of the patients involved in the study had a past medical history and were taking and are taking medications. The most common pre-existing medical conditions were hypothyroid, hypertension, and hyperlipidemia, which basically means elevated cholesterol. 46% of the patients are healthy with no past medical history whatsoever and are not taking any medication. This distribution, 46 and 54, is pretty close. 3 patients had been diagnosed prior with cancers. 1 breast, 1 lymphoma, 1 esophageal. The number 1 presenting symptom of all of the patients, of the 53 patients, 42 of the 53, or 79.2%, presented with a non-productive cough with a duration greater than 4 weeks. That's greater than 4 weeks. So it could be 8 weeks, 10 weeks, 2 months, 3 months. So what I did is went back and I said, you know what? I got to look at something. So I went back and reviewed all the charts. I removed all the other potential causations of chronic cough. That being a history of smoking, seasonal allergies, cardiopulmonary disease such as asthma or COPD or emphysema, and or medications that people take for hypertension can give you a cough. When I pulled all of those patients out, I still had 39 of 53, or 73% of the patients presenting, had no identifiable causation for their chronic cough. Number 2 symptom, headache. 40 out of 53 patients, or 77%, had headaches. We have to talk about headaches just for a second. Migraine headaches. The classical migraine headache, which some of you know, possible aura, which is a visual disturbance, prior to the headache usually. They get unilateral headaches on one side of their body. They're hypersensitive to sound. They have photophobia. The lights hurt their eyes. And they have nausea and vomiting. The headaches and the characteristics of the headaches from the gas leak were different. They had no aura. The headache was global, all over their head, or bilateral. There was no sensitivity to sound, no photophobia, and some patients had a headache without nausea. Of the 40 patients that had headache, only 4 patients had prior history of migraine headaches. All 4 patients that had prior history of migraine headaches complained that their migraines had increased in severity and duration, requiring Botox administration for control shortly after the blowout. Other common symptoms: nosebleeds, 34%, dizziness, 28%, nausea, vomiting, diarrhea, 23%, eye irritation, 13%, rash, 11%. Other uncommon symptoms that I picked up on that patients were allowed just to tell me what they were feeling: tingling of hands, tingling of tongue, forgetfulness, dry mouth, throat irritation, loss of voice, concentration issue, dry eyes, tearing eyes, chest tightness, and joint pain. Physical findings I have not totally correlated yet. I want to comment though on the evidence of nosebleeds. It seems to be a hot topic in the community, because I have no idea why. But obviously I'm not going to get a patient to come in and say, "Here, Dr. Nordella," as they're bleeding into a towel walking through the door, "See, I'm having a nosebleed," for proof that they have nosebleeds. But when I looked at people's nares, I saw dryness, I saw cracking membranes, and I saw dry blood. So I will testify, if need be, that there's people who have had nosebleeds. Right now, the word seems to be spreading because of events as such. So I get about 10 phone calls a day that I try and respond to. I've been noting information from case after case. Granted, these are not patients that I've seen face to face, but yet taking historical information. These diagnoses are made by other physicians at other facilities. There are numerous cases which I feel are very significant to the subject matter. 12-year-old female diagnosed with aplastic anemia. That is total bone marrow failure. They have no white cells, no red cells, and no platelets. It comes from the stem cell. It's documented in the literature from benzene, metabolized by the liver for the P450 system, goes to the stem cell and injures it, shuts off the bone marrow. The incident is 3 patients per 1 million population. They did not stratify by age. What that means is they didn't take and look at a population from birth to 80 and say we have a peak at this age and a peak at this age, but nothing in this age group. Literature documents an association between benzene and aplastic anemia. 7-year-old female diagnosed with leukemia. What kind of leukemia? Very interesting. Acute myelogenous leukemia, or AML. AML is most common in adults, approximately 90%, 10% in children. Rare. Incidence of 7 cases, 1 million patient population. Rare. Stratified for age. Lowest incidence was between 4 and 10. So what that meant is that the patients they saw when they stratified this between birth and 4 had a higher incidence of AML than when a 4-year-old or through a 10-year-old, the incident dropped, which made me more suspicious that this is more rare. Literature documents an association between benzene and specifically AML. Other cases, a central nervous system demyelination syndrome, recurrence of non-Hodgkin's lymphoma. Pancytopenia means the bone marrow is not wasted all the way, but it's certainly suppressed. Pulmonary arterial hypertension, pediatric anemias, new onset seizure disorders, new onset asthma. Hair loss in both adults and children, unexplained rashes. This all in a population of 30,000, approximately 30,000 people. I believe we're just scratching the surface and there's much to discover. We need cooperation and collaboration. We need patience. For clarification, I'm not stating this is a causation. I cannot do that scientifically. There needs to be a larger patient population studied in order to accurately represent the exposed community. I recommend, obviously, as a more in-depth, unbiased professional study be performed to the community. Someone from outside of California, preferably. I think it would be negligent to move forward and repressurize the system before you do this. Medical opinion. So in conclusion,
Thank you.
ideally, in order to come to a conclusion of causation, which I can, scientifically, one would compare the incidence of the illness and disease within an unexposed community. For obvious reasons, this is hard. This is very difficult. What I can say, and I think I can bring to the table very successfully, and I want to expand on this last paragraph, is I owned and operated the exact same clinic in Santa Clarita for 19 years. Okay? I saw the patients myself, hundreds and hundreds of patients, year after year, through seasonal changes, from seasonal allergies to flus, to common colds, to so forth and so on. I have never seen patients with such a disarray of symptomatology here at this facility that I saw for 19 years there. So it gives us a maybe, and that's why I'm kind of very interested in this, it gives maybe a little light on what's happening here is certainly not normal. I thank you.